Hi, this is Elizabeth Galantine, Associate Editor with Employee Benefit Advisor. Yesterday we spoke with Robert Zirkelbach, Communications Director of America's Health Insurance Plans, on several topics. First among them was AHIP's decision to be one of several stakeholders sending a letter to the President last week promising to curb healthcare costs in the future.
There's widespread agreement that we need to get healthcare costs under control if we're going to be able to do comprehensive healthcare reform. At the White House Healthcare Summit in March, the President said that healthcare costs were crushing the economy. And he challenged all stakeholders to be a part of this process, to offer solutions. And what you saw last week is the private sector stepping up to the challenge the President laid forth to offer comprehensive proposals and to show a strong commitment to bring the rate of growth of healthcare costs under control. And the group is committed to working together to offering a specific framework of how to get healthcare costs under control. And that is something that the groups are committed to, and we're willing to step up to do our part to accomplish this goal. Each stakeholder is going to be looking within their own sector to find out what they can bring to the table to bring costs under control. We're looking at ways that we can work collaboratively with the other stakeholder groups to make the system work better. And we're going to be offering a comprehensive framework, including legislative proposals to help achieve this goal.
And what's the timeline for that?
We should see some specifics coming out in June.
Next, we asked Robert if the letter could be interpreted as a mea culpa from the industry.
Well, America leads the world in healthcare innovation. We're providing the latest technologies, the latest drugs, and we have some of the best doctors and hospitals in the entire world. But there's a recognition that we can do things better and more efficiently, and that by working together and by also taking a hard look at our own industries, we're going to be able to offer some specific policy recommendations that are going to help bring healthcare costs under control. So it's not trying to assess blame to any industry or any group as a whole, but to instead say, what can we do to make the system work better, and what can we do collaboratively to implement the types of reforms that everybody recognizes are needed to get healthcare costs under control.
Next, we asked Robert if recent calls for more regulation coming from AHIP is a PR move.
We have been saying for more than 3 years now that now is the time for healthcare reform, that the current system is not acceptable and it's not sustainable. It is unacceptable there are 47 million uninsured Americans outside of the healthcare system. Rising healthcare costs are hurting families and impeding our competitiveness around the world. And we recognize that we need new market rules and new consumer protections to ensure that nobody falls through the cracks. So we have been very involved in this process for many years now to develop workable, constructive, comprehensive proposals to address the healthcare concerns that we've heard from the American people. Most people have a very favorable opinion of their health insurance coverage, but there's a recognition that people are falling through the cracks, and they are encouraging policymakers to look at this issue to find ways to address that. And that is what we have proposed as a way to ensure that all Americans, including those with pre-existing conditions, have access to health care coverage.
We asked Robert if a call to reduce healthcare costs is against the insurance industry's interests.
Not at all. This focus, a lot of what this coalition is going to be focusing on is how can we make the system work better? What can we do to make things work more efficiently, more cost effectively, and we can do things smarter that's in the best interest of consumers and providers and employers across the healthcare system. So it's not just simply taking an axe to the healthcare system, to costs in the healthcare system, but it's looking at ways we can do things better, more efficiently, and smarter. So we believe that getting healthcare costs under control is essential to be doing comprehensive healthcare reform in this country, and that's why we've been so proactive on this front for many years.
Last, we asked Robert about AHIP's relationship with brokers.
Absolutely. We work very closely with the broker community. They're a very valuable part of the healthcare delivery system, and they work with our members, and our members work with them on a regular basis. And in a reformed environment, the broker community is going to continue to be an important player in this whole process. So absolutely.